sure you're down here and you're pinching here.
So my name's Caleb. I'm a physical therapist. I went to the University of Dayton for PT school, played football at Olivet Nazarene University. I'm the owner and only physical therapist at Cat Performance and Physical Therapy. We specialize in sports medicine, specialize in ACL rehab. We started in January, so we're about 11 months in. And yeah, it's been a fun journey.
Yeah, and I'm Zach. Orthopedic surgery resident currently. From nearby Ashland, Ohio. Are you from?
I'm from Dayton.
Dayton, you're from Dayton.
Yeah.
So, yeah, no, I'm from Ashland originally. Familiar with the North Canton area, and then up in Cleveland currently. Went to school down in West Virginia. Been up here now, back home for 2.5 years or so. Got a couple more years to go, and just recently started the Hustle brand. Something I'm really excited about, something to work with athletes. I played football in college as well at Ashland University. Something I think could be really, really big in terms of just working with athletes and the everyday weekend warrior all the way through, your middle-aged adult. I think there's no reason to stop thinking you can't be an athlete or train like an athlete.
Yeah.
If you always have that mentality, right?
Yeah.
You can prevent injury and live a very healthy, effective, efficient, and productive life. I think we talk about all the time being an athlete, right? Like what that did for you,
right?
In your discipline, your approach to everything you do as a professional, your day-to-day life. I know I'm healthier today now because I was an athlete in the past.
Yes, yeah.
So I think it's something that could be really special. This kind of hustle, big cat performance, kind of a collaboration, a collaborative effort for a greater good.
I think that's huge, like expanding the definition of athlete to more than just like sports participation.
I have people all the time, and I'm sure you do too, like, I don't know, the workouts probably are a little ridiculous, and they've probably at times caused me a little more aches and pains than I should probably rest a little more than I do, because times you're on call or you're not getting enough sleep, and you know how important sleep is to recovery. You can take all the supplements in the world, you do all the stretches in the world, you can lift all the weight in the world. If you're not sleeping, and you're not recovering adequately, there is a persistent use stress, but there's also then stressing yourself, in a disproportionate manner to your recovery, and ultimately a loss in gains. And so I don't know, I think teaching people how to be efficient, effective, healthy, while also prioritizing the rest of their life is really important.
I feel like from my perspective, like as a physical therapist, having a surgeon that gets it, it in quotation marks, is like half the battle. If you have a surgeon that's on board, kind of understands this side of it, because I've worked with a lot of surgeons that don't understand that, or don't see the importance, or think what we do is just kind of reading off a sheet of list of papers, of just like kind of your generic exercises. So having a surgeon that gets this side of it and can honestly probably do this side of it as well, that makes it much more like the continuity of care. It's just a lot better. So I appreciate it on this side of it, on like the rehab side of it, just because he understands and he gets it.
Yeah, I mean, God, there's so many directions that you go with it, because you run into it every day. It's just like people are critical of each other in their own field, but I mean, you hear the slander between an orthopedic surgeon and a PT. You hear it. It's just like, I think it's more of one of those things, you got to be a team. And again, if you were an athlete, you understand the team aspect of things. So everybody is a team, right? Everybody's a teammate. And I don't see a physical therapist as like, oh, well, hey, I did the surgery, you get them back to rehab. It's, I did the surgery, I want to be a part of the rehab. I'm going to have exponential a number of patients one day. I'm not going to be able to be, actively hands-on involved in their care. I'm not going to be at their rehab sessions. I'm not there in a PT session. So you have to somehow get across the same mindset to a therapist as you have. And so, talking openly to a physical therapist, seeing the other side of it, understanding why they're doing things is going to help you as a surgeon too, for your patients in the future.
Yeah, I think we both hold a unique attribute. The PT has spent an exponential amount of time with them. The surgeon has actually seen the inside of this person's knee. So we both bring something to the table, which, and I think pieces of the puzzle. I think it could fit really well together. I just don't think we do a very good job.
No, I don't think they do either. And part of that's reimbursement. Part of there's so much dollar figures and money. I don't think your guys' side of things is reimbursed appropriately. A lot of people don't see the importance of it.
Yeah.
I think that then on the opposite side, you guys, not you specifically, physical therapists, you hear all the time like, oh, you don't need surgery.
Right.
You could just do rehab, and a surgeon just wants to, cut somebody open. They just want another surgery. It's like, I am going to be busy enough in the future. Every orthopedic surgeon, there's not enough of us. There's enough work and surgeries to go around. I don't need to create surgeries for myself. If I'm going to ever take someone to the operating room in the future, it's because I genuinely think that they need it. They have exhausted all conservative measures and prehab and all kinds of rehab they could. And at this point, if I'm taking them to the OR, it's because they absolutely need it. And I think that they're going to be better because of it.
Right.
I'm not going to ever take somebody under the knife because I don't ever want to make somebody worse off. Like, that makes no sense.
Yeah.
So there is, in both ways, I think orthopedic surgeons have given PTs this bad rap of, well, they don't do anything. They could this person could do that at home.
Right.
And in some cases, yeah.
Which I think that that's a good criticism on the PT profession, because it's like, am I providing value where they couldn't do this at home?
Yes.
Like, I don't know. I think you go to PT a lot of times and you probably could have done that at home. Like they're reading off a sheet, and so it's like the challenge to the PT profession is then like be better than that.
Yeah.
Like provide more value.
I mean, as a surgeon, knowing your patient too. Is this a self-motivated individual who could do the rehab? Or is this somebody that I need to make sure and emphasize they go to a physical therapist, they work at a rehabilitation center because they cannot do it on their own?
Right.
And you guys are critical then at that point if I think somebody needs you that bad.
Right.
It's crazy because we're not talking about total hips here either.
Yeah.
There's a lot of literature out there, a lot of studies that show a total hip patient is going to do just as well doing rehab on their own.
Right.
People do fantastic after a total hip.
Right.
You do a good surgery, they're a self-motivated individual. They don't need to go to physical therapy. They can do a lot of that rehab on their own.
Right.
We're talking about athletes here with very complex problems who would benefit from physical therapy.
Right.
Right. So
for sure.
I said it already. We're busy enough as it is. And that's, I think, as important a point as any is to get the surgeon more involved in the preventative care. I think that's medicine in general. Everybody goes through medical school, sees all this chronic illness, whatever specialty you may be in, and you're on the side of treatment, right? You're not on the preventative side. There's very little, again, reimbursement or initiatives to support preventative care in our country as a whole. So I think social media is a gigantic, open, free engine to peddle content to people that is beneficial to them. I like to say that, like, everything we talked about here today and are going to talk about in the future is what, 5-10 minutes out of your day? It may not be as fun as watching a movie or looking on Instagram, but if you can somehow just ingrain in people's minds 5-10 minutes a day can prevent me a trip to the therapist or the orthopedic surgeon. In a perfect world, we become extinct.
Yeah.
It's never gonna happen.
Right.
But yeah.
I mean, put it again. Even if it is 5-10 minutes, it takes that sacrifice, and whether it's sacrificing some of your time to go to prehab or sacrificing time to have to go to physical therapy, it's like you got to pick which do you want. And I think if you put the work in on the prehab, you're a lot less likely to have to come see us.
And most people get through their life, if they weren't an athlete, they don't have many major injuries, and so I think it's hard to see if you feel good from your day to day. You don't think about it. You don't think about doing, little exercises and stuff. You're like, I got my Planet Fitness membership. I'll go walk on the stair stepper once or twice a week, and that's good. That's good until eventually the biological clock starts ticking and things start breaking down. And, all along there were things you could have been doing to, make yourself better.
For sure.
But it's hard to get that across to people. You don't realize all the small little biologic processes that are working in your body every day. And
I feel like interest in this kind of subject is at all-time high too. I mean, people are so much more informed. Social media, pros, cons, pros of it being people are so much more informed. Like you see people, just people doing stuff that would have been like mind-blowing, 5-10 years ago. And that's just like a regular part of like a CrossFit warm-up now,
Exactly.
Like the popularization of crossover symmetry, like stuff like that. So, I mean, it's a good thing, but people they're hungry for this information. They know it's out there. There's just a lot of it. You got to cut through the noise.
You got to cut through the noise, and you got to get accurate information too. Sure. There's a lot of, just like there are people who have gone through the schooling and education that we have.
Yeah.
There's people who have gone through that schooling and education who are spitting out, poor information, bad studies, things with a personal agenda.
Right.
But there's also people with absolutely no background, zero, who get a certified personal trainer license or something online, who have very little credentials. Doesn't mean that they can't be, really intelligent and have done a lot of personal research on it. Right. But there's a lot of misinformation or false information out there. And like you said, as much good as there is to come out of social media, there's a lot of bad too. Yeah. And I think there's a lot of people who don't want to put in the effort that you and I are doing. Like, it's a Sunday afternoon, we could be doing a lot of other things. Right. But to come out here, take time out of your day to, put this information out there, good information or helpful information just shows that it can help people.
Yeah, being a PT, like in my family, it's just like, my grandparents, like how much information they get from other PTs online, their personal trainer, their friend from church. Like, it's just, you're constantly like battling like the misinformation / everybody wants to be a PT.
Yeah, and boiling down the basics too.
Yes.
We have kind of lived in this world our whole life.
Yeah.
Right? Like, this has always been interesting to us. If you're an athlete, you don't realize all the little things you pick up about your own body and just the musculoskeletal system. Right. That when I say, you said rect fem earlier, like the rectus femoris, like if you ask 99% of people walking the earth, like, what is your rectus femoris? To us, that's like, point to it. That's the easiest thing in the world. I bet Wes probably, no, like rectus femoris. And I don't know, that's not to say that we know everything about the musculoskeletal system, but you just don't realize the basics aren't basic. Right. Like, the slang and words and basics of the musculoskeletal system we know is not at all layman's terms.
Yeah. I catch myself like that because I'm operating like there's this like baseline level of understanding. Yeah. And so I'm talking here, thinking we've already agreed here. Yeah. That's like, oh shoot, like I need to not dumb it down. That's not right way to say it, but I need to address these things here first before we can talk here.
Meet the patient.
Yeah. Yeah.
I mean, there's so much low health literacy, and then there's so much just in general, just people don't know the musculoskeletal system. There's a difference between health literacy and also just not knowing muscles and bones and tendons and everything. Right. Like that's not even low health literacy. That's just information that if they're an accountant, why would they know that? Yeah. So I mean, and that's why I think a clinic day for us, I would argue, 40 patient clinic day is far more exhausting than going in and doing 6 big surgeries, because you are sitting there over and over meeting different patients, diagnosing, evaluating, but most importantly, you're taking all this information you have, all the physical exam findings, all their lab values, whatever it may be, and then you have to portray all of your thoughts about their diagnosis to them in a manner that they understand. Yeah. And that's like complex thinking that becomes routine, but is exhausting. You just don't really know. Yeah, for sure.
Yeah. I think, paying attention to like the wording you're using. I mean, it's like the soft skills of the PT. Yeah. And like you working with patients as well. It's like, that stuff you don't really talk about that in school at all. No. At least we don't.
We do some clinical encounters, but it's not the same as seeing.
Oh, heck no.
Yeah. They could give me a fake encounter all they want, and I could go in and talk to this person trying to play a patient, but they're not the best actors, and I know that it's still fake. Yeah. It's hard to make it real.
Yeah. You mentioned neurotic earlier. There's a couple of patients that are just like super in tune, like with everything. Like
they've got a notebook.
Like they're just looking at me the entire time, like to make sure they're doing things okay. And like by the end of that session, I'm tapped. It's like an hour, and I'm like, wow, that was a long session. Yeah. So I mean, I think there's so many different sides of the ACL, like psychological, physiological. Obviously, bringing them into a gym environment surrounded by other athletes is huge. I can't tell you how many athletes come in, and I inherit them at 6 months, and they're like, dude, the last 2 months, I wasn't even going to physical therapy because I was surrounded by old people. Yeah. And not that I love old people.
No, same here.
God, I love my grandma. Here. She's amazing. Yep. But like, making an athlete feel like an athlete again. I mean, we're talking, 9, 12 months of rehab. Like they lose a little bit of their identity. So like bringing them into the gym atmosphere, I think is big, where they're surrounded by other athletes. And then, obviously like developing trust, a lot of the exercise we showed. It's about like rewiring, restoring movement, especially in those early phases, getting them to trust their leg again, because I can't tell you how many like ACL patients that are a year out and all they do is think about their knee.
Yeah.
They're jumping, they're cutting, they're running, all they're doing is thinking about their knee. We want to promote this unconscious competence where they're performing at a high level, but they're not even thinking about their knee.
Yeah.
So I think that's like a big early phase, starting to like kind of address some of those like compensations that they develop from like a really tough injury. I mean, it's a tough injury. It's a hard thing to come back from. I think most people think it's like a wrap on their career, you know, like it's kind of like the death sentence of you'll never be the same. And I think being able to be like, hey, no, you will be the same. And like, here's a really like aggressive plan of how we're going to do it. Safely aggressive. Aggressive plan of how we're going to get you like, back to where you were, if not better, you know?
Yeah. Yeah. I mean, you know, obviously ACLs are kind of specific to athletes unless you're out skiing in your 40s and you take a bad hop or something. Like, it is fewer and further between as you get out of that adolescent age bracket or collegiate athlete age bracket, right? But then you move on to, you know, your hips and your shoulders and everything. Knees, you're going to get arthritis one day. Like a lot of people are carrying extra weight and you're putting it through your knees and it's, you know, you're going to get arthritis, right? But your hips and your back and your shoulders, those are places that people just treat like shit their whole life. And so coming in, or just if you are just a, you know, everyday average Joe who's going punching a 9 to 5, and taking care of those areas can prevent you a trip to me, at least in the future, for whatever it may be, low back pain evaluation, hip pain evaluation, a shoulder pain evaluation. You know, we talk about the crossover symmetry, preventing chronic rotator cuff tears, you know, things that everybody's using their upper body their whole life. You know, Mima comes in, you know, after having no periscapular strength, no rotator cuff stability her entire life, and she's got a chronic rotator cuff tear. Like, maybe it would have happened, maybe it could have been prevented if, you know, you just do some minor little things 5 minutes a day for your whole life. Same thing, you improve your posture of your shoulders, you're inherently improving your upper thoracic health and mobility. You're improving that strength. You're not sitting on your phone. You're not sitting at a computer. You can't, you know, undo 8 hours a day of this with just a few minutes doing that. But you can surely put a dent in it, or at least get your mind thinking in the right direction about, okay, I gotta be more mindful of my posture.
Yeah.
And then from a hip standpoint, low back pain is everywhere. Everybody has low back pain. I don't know how much of it you guys see here, but I'm sure you see it.
Yeah.
And a lot of it, some of it is hip pain, some of it's back pain. Those go hand in hand. We have people come in and say, my hip's killing me. And they're pointing out here, right? You know, or they're pointing out here, that's your back.
Yeah.
You know, that's not coming from your hips. It's coming from your lumbar spine, pinching nerves. They're running down your leg. You're getting ridiculous symptoms. Hip pain is in your groin.
Yeah.
You know, I think that's a misnomer people have. And putting out information that we talked about this stuff will educate people on that. And so they at least have some idea of their own care coming in.
Right.
The hip halo activation before any workout. You can't just go in and squat house. You're going to tear a labrum. You're going to impinge. You're going to hurt your hip. You're going to hurt your back. So the workout or the warm up that we talked about today is really important in injury prevention and just going to work pain-free every day.
Right.
You don't have to get out of bed every day and dread going to work because you know you're going to sit at a cubicle and hurt at the end of the day. You don't have to hurt.
Yeah. And like I like that it's an active approach. You know, I think a lot of people with back pain or even maybe like preventing back pain, that's like, you know, and I like a massage too. Like massage is great, but like there are active things that we can do, and those are probably going to hold a lot more water long term. You know, massages feel good, but it's like if we're actually trying to make some kind of adaptation or change, like it's going to require some kind of work.
And you've seen this a long time. People think stretching is the answer. Stretching is important.
Yeah, yeah.
Strengthening, maintenance, comes through small little exercises like that. Stability exercises, things that you don't want to do because you don't have the perception that it's going to get you the big muscles, right?
Right.
You know, you got to do all that little stuff. So if you're going to focus on anything, stretching is important. You should stretch. I don't know how you feel. I would emphasize stretching at night before going to bed.
Yeah.
I think there's a lot of good support and literature out there for that makes people feel better when they get up in the morning. You stretch before you go to bed. Yeah.
And I mean, if we're looking at what most people are doing before bed, it's like on the phone, scrolling on TikTok. It's like a good way to get you into like a parasympathetic state, probably sleep a little bit better and feel better.
Yeah, some breathing exercises while you're doing stretches.
Oh yeah.
Again, 5 minutes.
Yeah. Put the phone down.
Yeah,
I think that'd be awesome.
easier said than done. But
For sure, yeah. Like I'm not saying I'm always best at that.
No, I'm not either.
Yeah.
So, like I still, my bed looks really tempting sometimes. I'm like, I could sit on a mat and do some stretches, or I could just fall asleep right now. Like you're gonna just go and get
right
sometimes. But every day you try and do a little preventative care. Could again prevent a trip to UNI.
Yeah, that's the goal at the end of the day. Educate people so that they don't have to come here.
Yeah.